Hi, Dr. Shevers. How are you today?
Good. How are you?
Good. I'm speaking today with Dr. Shevers from San Jose, and this is one of our many conversations that we have been having and will continue to have. And I'm just wondering, what did you want to talk to us about today?
Today we've had just a real rash recently of people who are developing neck and upper back problems as kind of the office place changes and you don't have a prescribed office anymore or cubicle. You go and you just set your laptop up in one of the various areas at the office, and then you carry your laptop around and use it on the way to work and have work from home scenarios where you're working from home several days a week. And the convenience of a laptop is excellent, but if you're going to sit there and work at it for hours, it's really, really important that you get a different monitor, or if you're using the laptop monitor, make sure that it's at eye level so that you're looking down, you're looking across the middle of the screen. You're not constantly for hours sitting with your head tilted down or tilted up. That develops a lot of mid-neck problems. And then most laptops, even the bigger ones, the keyboard is much smaller than a standard keyboard, and you have to bring your hands in to use it. And just that continuous hunching of the shoulders just leads to all kinds of problems in the upper thoracic area. So it then becomes really important you just get a wireless, a regular keyboard and set that up in a keyboard tray at a desk so that you're sitting and working at that station correctly, because just working in a laptop continuously leads to all kinds of problems and headaches. And there's just, although chiropractic care really does help with easing the symptoms, you don't want to have to keep going in over and over and over again when you're just recreating the problem every day.
Yeah, I understand, because I actually have a laptop, but I have it set up as my screen, and then I have my ergonomic keyboard. Is there any other suggestion besides what you just shared about what to do in a situation like that, which seems a lot of people are in that situation?
One of the most important things, especially as people are working from home a couple of days a week nowadays, is you need to, at the bare minimum, at least set yourself up the kitchen table. Sitting, cross-legged on your sofa with your laptop in your lap, if you do that 2 days a week for 4 or 5 hours, you are just asking for all kinds of problems. And at home and in places where you can't set something up perfectly ergonomically. You're on business travel and you've taken your laptop with you, so you're in a hotel room, and the best you've got is the desk that's in the hotel room. Really kind of one of the big things to remember if you're forced into one of those situations where everything isn't ergonomically correct for you, is every 30 minutes get up and walk around and stretch out for 5 minutes. Then everything doesn't kind of have a chance to get out of place and lock up and become so bad. If you're kind of getting up and moving around, it really helps eliminate some of those problems. Take your yoga mat with you when you go to do it. A lot of hotels nowadays have a spa that has a chiropractor in it that, they really are, their practice is geared towards new people and, just going in and getting a quick adjustment and not having a whole, exam and treatment plan. They cater towards somebody who just, needs an adjustment, and that's it. So if you're traveling, those are kind of things that you can do as well.
Interesting. I didn't realize that hotels now sometimes have chiropractors.
If you look around, a lot of the spas now do have a some of the higher end spas will have a chiropractor in it. In fact, San Francisco Airport has a chiropractor in it.
Oh, yeah?
Yeah.
Well, I'm just wondering if, right off the top of your head here, you think of any case in particular that's came to you presenting, the neck and shoulder problems and it was being caused by this exact situation you're talking about now.
A middle-aged lady that had been doing real estate for the last 10 years, so she'd been, up and around and not really a desk job at all. And she switched into some kind of real estate position, acquiring homes for some kind of foundation. Not really important, but it became, she went from being a realtor that was out in the field to someone that was doing a desk job. And, she kind of, came for a once every month or once every 6-week appointment, but never anything serious, and had, all of a sudden started to have these neck and shoulder pains and couldn't understand why. And it ended up totally being that she, for the last 6 months had been working at a laptop without a proper chair or anything, and was just hunched up and started getting horrible headaches. And, came in, and once we worked on her probably 5 or 6 times, because she actually thought it was because she'd fallen down, and it really wasn't getting any better. So we took some x-rays, and, she had started to lose the curve in her cervical spine, and we started talking.
Just in that short time, from just being hunched over like that for 6 months?
Yeah, for like about 6
wow.
months. It had started to, and we'd actually
That's scary.
and we'd had previous x-rays of her, because she'd been a fairly long-term patient, where none of that was visible, and the pain really wasn't changing, so we were pretty sure it wasn't a traumatic incident, and especially when things would start to ease if she was, not at work for 5 or 6 days or whatever. And finally we're like, okay, look, we're going to put you on a treatment plan, and we're going to see you, I think it was 12 times over 5 weeks or something like that. And told her that she really needed to change her workstation when she'd told us that, and we were pretty sure that that's what it was. And got a new monitor and got a keyboard tray with a new keyboard for her, laptop instead of using the laptop at work all day. And, within 5 weeks, she was symptom-free. So.
Hi, I'm Dr. Lisa Long with Long Chiropractic. Since 1992, I've been passionate about helping patients relieve their pain and get healthy. When a patient walks into Long Chiropractic in pain, it's so rewarding to watch their transformation back to their normal lifestyle. I want you to feel better so you can be happy living your life again. Don't choose to live another day in pain. Choose Long Chiropractic.